Welcome to Seasoned and Bold channel. If you or a loved one has faced a cancer diagnosis, the immediate question often is, what should I eat now? This question goes beyond simple nutrition. It's about transforming our body's fundamental environment. Understanding health and disease, structural versus functional medicine. Modern medicine is often structural medicine. It intervenes when a structure is already broken. However, a more comprehensive approach aligns with functional medicine. This means addressing issues when function begins to decline during what we call the pre-disease stage. Hippocrates famously said that illness is the cumulative result of small daily wrongs. You don't just wake up sick overnight. There's a gradual process of minor discomforts and fatigue that, while not showing up on standard tests, indicate a deeper functional imbalance. Your body as an orchard. The power of blood and diet. Think of our bodies as the soil of an orchard. If the soil is rich and fertile, healthy, delicious fruits will naturally grow. But if the soil is polluted with oil, heavy metals, carcinogens, or reactive oxygen species, then diseased fruits will appear. Conditions like high blood pressure, diabetes, or cancer. Modern medicine tends to cut off the diseased fruit without addressing the soil. Our goal is to change the soil of our body, specifically the composition of our blood. The most powerful tool for this transformation is food, as nothing influences our bodies 24 hours a day like what we eat. A week of unhealthy eating can make you feel terrible and reflect in your blood tests, while a week of clean, fresh, good food can make you feel revitalized and improve your blood work. Let's decode fats and oils, the good, the bad, and the essential. When we talk about fats, we distinguish between solid fats, often saturated, and liquid oils, often unsaturated. Saturated fats, typically animal-based like those found in meat, processed foods, cheese, and butter, are often linked to cardiovascular issues. Plant-based saturated fats include palm oil and coconut oil, which are solid at room temperature. While saturated fats have been somewhat rehabilitated in recent studies, trans fats are truly harmful for cardiovascular health, and saturated fats have sometimes been wrongly blamed for their effects. However, coconut oil has a unique role, particularly for cancer patients suffering from severe malnutrition or cachexia. Its medium-chain fatty acids are not a food source for cancer cells, but provide essential energy, making it beneficial in such critical conditions. Generally, unsaturated fatty acids are much more beneficial for our bodies, a point on which many medical professionals agree. Among these, omega-3 is critical for alleviating inflammation, preventing vascular disease, and promoting healthy cells. Omega-3 fatty acids, such as EPA and DHA, are integral components of cell membranes and are precursors to signaling molecules that play crucial roles in regulating inflammation, blood clotting, and blood vessel constriction. The best sources are perilla oil and flaxseed oil, which are superior to supplements. It is crucial to consume cold-pressed perilla oil because heat, light, and oxygen cause it to become rancid. Storing it in single-serving packets further prevents oxidation. We recommend a teaspoon of perilla oil morning and evening. Omega-6 fatty acids found in soybean oil, sesame oil, grapeseed oil, sunflower oil, and corn oil tend to increase inflammation in the body. Therefore, the ratio of omega-3 to omega-6 is vital, ideally 1:1, but certainly no more than 1:4. Omega-9, a monounsaturated fatty acid, is found in olive oil and avocado oil. These are excellent for salad dressings. Avocado oil, with a glycemic index of only 10, also helps lower the glycemic index of subsequent foods. Carbohydrates, the good, the bad, and the smart approach. Carbohydrates are our body's primary energy source. Many cancer patients proudly declare they avoid carbohydrates completely, thinking they are starving cancer cells. However, this is a dangerous misconception. Cancer cells consume carbohydrates, but so do our normal cells. If you starve yourself of carbohydrates, you will suffer before the cancer cells do. The key is to distinguish between good and bad carbohydrates. We can understand this through the principle of a PET scan. When you receive a glucose injection for a PET scan, the glucose spreads throughout your body and cancer cells, being aggressive, quickly absorb it, appearing brightly on the scan. The glycemic index (GI) concept is crucial here. Bad carbohydrates cause a rapid spike in blood sugar, similar to the glucose injection, which disproportionately feeds cancer cells. These include refined carbohydrates, white rice, white flour, white sugar, white salt, and white artificial seasonings, what I call the 5 white foods. Good carbohydrates, on the other hand, cause a slow, gradual rise and fall in blood sugar. The best examples are vegetables. About 80% of vegetables consist of dietary fiber that humans cannot digest, meaning only about 20% is absorbed slowly. This slow absorption ensures that carbohydrates are distributed evenly to all 100 trillion cells in your body, meaning 99% goes to normal cells and only 1% to cancer cells. When adopting a plant-based diet, diversity and whole foods are essential to prevent nutrient deficiencies. Eat a wide variety of vegetables and fruits, and consume whole grains with their skins intact, as the skin contains vital nutrients and fiber that lower the GI. Now let's discuss about protein, the body's building blocks. Many mistakenly believe protein is an energy source for strength. Protein is actually a structural component of our body, like bricks, forming our tissues and immune cells. The World Health Organization doesn't set a daily recommendation for carbohydrates, as they are an energy source whose need varies with activity, but protein has a daily recommended intake. Adults generally need about 0.5 to 1 gram of protein per kilogram of body weight to replace daily losses. Excess protein is not stored like carbohydrates, which convert to fat. Instead, it can putrefy in the gut, leading to issues like diarrhea and potentially toxins. Regarding animal versus plant protein, animal protein is considered a complete food because it contains all 9 essential amino acids that our bodies cannot produce. It also provides vitamins like B12, iron, and zinc. However, animal protein often comes intertwined with saturated animal fats, which can contribute to cardiovascular disease. Plant protein, while often incomplete, lacking all essential amino acids in one source, but it is generally healthier. To get all necessary amino acids from plants, you must consume a large variety of plant-based foods. Crucially, there are situations where animal protein is necessary for growing children, the elderly, those with weakened digestive systems, or impaired absorption, for example, during chemotherapy, due to its easier digestibility compared to plant protein. There is no single dietary prescription for everyone. It must be individualized. Gerson therapy, a scientific and practical approach. Gerson therapy is developed by German physician Dr. Max Gerson in the 1940s to treat various chronic diseases, including cancer. While traditional cancer treatments like surgery, chemotherapy, and radiation became prominent later, Dr. Gerson focused on diet, exercise, stress management, and environmental detoxification. Modern Gerson therapy is a therapeutic diet, not just a general health diet, and its intensity and protocols differ. It is backed by extensive physiological and biochemical theories, unlike some other dietary approaches. The therapy uses various tests to tailor and continuously adjust the diet based on the patient's specific condition, such as cancer type, treatment history, surgery, chemo, eating ability, and organ function. The core principles of modern Gerson therapy are low sodium and a vegetable-centric diet. From biochemical perspective, maximize the intake of diverse vitamins, minerals, antioxidants, and anti-cancer compounds from vegetables. From physiological perspective, utilize the difference in sodium-potassium concentration between blood and cells to detoxify cells, reduce cellular swelling, and promote healthy cell metabolism by facilitating oxygen entry into cells alongside potassium. For cancer patients, this often means consuming 5 to 9 kilograms of vegetables daily through various methods: salads, roasted vegetables, steamed dishes, juices, and soups. Whole grains, like brown rice and oats, are consumed in 2 meals, often as rice or porridge. A large plate of fresh, seasonal salad with olive oil, balsamic vinegar, perilla powder, or perilla oil dressing is eaten before each meal to lower the glycemic index of subsequent foods. Small portions of diverse fruits are also consumed immediately after salad. Plant-based protein, such as soy milk, natto, or tofu, is encouraged, and meals are rounded off with nuts. Additionally, patients consume 10 200 milliliters glasses, total 2 liters, of fresh vegetable juice daily, made from greens like kale, fresh wheatgrass, carrots, unless diabetic, beets, and lemon. This intensive regimen ensures ample nutrients and calories, and despite its complexity, our adapted version allows patients to maintain normal social activities. Now, let's discuss beyond diet, a holistic approach to cancer prevention and treatment. There are 3 main categories for cancer causes. Genetics. Fortunately, the genetic predisposition for cancer is lower than for metabolic syndromes like hypertension or diabetes. Risk factors. These are largely controllable: diet, exercise, stress management, avoiding smoking and excessive alcohol, and managing obesity. Immunity. Our immune system naturally combats cancer cells that form as we age. A strong immune system is crucial for prevention and fighting existing cancer. Successful patient cases show that consistent dietary therapy, a positive mindset, and diligent effort are critical. Patients who worry less and focus their energy on consistent self-care tend to achieve better results. The power of early detection and smart screening. A common misconception is that serious diseases always present with symptoms. In reality, critical conditions like brain aneurysms, heart disease, or cancer often have no symptoms in their early stages. Therefore, proactive, regular health screenings are paramount for early detection and successful treatment. Regarding diagnostic tests, no single test has 100% sensitivity and specificity, so multiple tests are often used for cross-checking. PET scans are not for precise diagnosis, but rather screening tools to detect suspicious areas or metastasis carrying significant radiation exposure. Avoid unnecessary CT scans for general checkups, e.g., abdominal CT instead of ultrasound, coronary CT without symptoms, brain CT without neurological signs due to radiation exposure. We highly recommend several specific screenings: gastroscopy, upper endoscopy, and colonoscopy. These are crucial when stomach and colon cancer rates are high due to dietary habits. Gastroscopy should begin in your mid-30s and be done every 1 to 2 years. Colonoscopy from the 30s onwards, with frequency depending on polyp findings and family history. Ultrasound. This is a fantastic low-cost, radiation-free tool for frequent checks of organs like the thyroid, breasts, liver, pancreas, spleen, and prostate. MRA, magnetic resonance angiography, for brain aneurysms. Around age 40, consider this scan. Brain aneurysms are silent threats affecting about 2% of the population. Early detection allows for minimally invasive treatment, preventing potentially fatal ruptures. CT and MRI serve different purposes. CT uses radiation, is fast, and excellent for bones, lungs, or detecting acute bleeding. MRI uses no radiation, takes longer, 40 to 50 minutes, and provides more detailed images of soft tissues like joints, ligaments, spine, and the brain. The most expensive test isn't necessarily the best. Each has its specific utility. To summarize, here are key suggested actions to prevent cancers. Eat abundant vegetables. Consume a large, diverse quantity of vegetables daily, raw in salads, cooked or juiced. Always start meals with a generous salad. Prioritize omega-3 oils. Take 1 teaspoon of cold, pressed perilla oil in the morning and evening. Use olive or avocado oil for salad dressings. Choose whole grains, opt for brown rice or oats for meals, and eat fruits/vegetables with their skins. Avoid 5 white foods. Eliminate refined white rice, white flour, white sugar, white salt, and white additives seasonings. Plant-based protein. First, incorporate plant proteins like soy milk, natto, or tofu into your diet. Stay active and stress-free. Engage in regular physical activity and practice stress management. Regular screenings, schedule gastroscopy, 1 to 2 years, colonoscopy, 3 to 5 years, and ultrasounds is recommended every 1 or 2 years. Consider a brain MRA around age 40. Being healthy isn't just the absence of disease. It's when all our organs and systems function optimally. By adopting healthy lifestyle habits and diligently undergoing regular health checkups, we can prevent diseases or detect them early for a full recovery. Don't wait for symptoms. Be proactive. Your persistent efforts and positive mindset are powerful allies in your health journey. Thank you for watching and stay healthy.